Hello, everyone. Very good afternoon to everybody, to our listeners and the viewers. We welcome you all to the all new Health Darbar show hosted by Dr. K.K. Agarwal's Heart Care Foundation of India. And I'm Dr. Pinky Chauhan, clinical editor with the foundation and the IJCP group. Today, 19th of July, 2 p.m., we bring to you yet another informative session on sinus and its relevance to COVID 19. As we all see that COVID 19 is still lurking in the corner and we have patients increasing gradually, if not, in an epidemic proportion. So, we have a special guest today on our show who will be speaking on the sinus infections. May I introduce Dr. Kshitij Shah, who is the Associate Professor, ENT and Head and Neck Surgery at LTMG Hospital, popularly known as Sign Hospital, Mumbai. We welcome you, Dr. Kshitij. Very good afternoon. Thank you for being a part of the show. And
Hi,
yeah,
Pinky. Good
would you
afternoon.
like to say a few words to our viewers, sir? Yeah.
It's lovely to be here. Thank you for the opportunity to let me share my views on what is probably be a very hot or a favorite topic in ENT. Sinus क्या होता है? And yeah, I'm ready to kickstart with you. So let's do this.
Okay. So, sir, regularly in the clinical practice, you might have heard this word patients come to you and say, Doctor साहब मुझे sinus है. ठीक है. So I would like you to put on brief, get on some light. What is the sinus actually, and is it a normal part of our body, and what are its normal functions in a normal human body?
Right. So yes, as you rightly said, a lot of people come and colloquially say कि हमको sinus है, मुझे sinus है. It's like saying maybe I've got a thumb. It's a part of the anatomy. So sinuses are a
Yes.
normal part of the body. And let me just quickly explain what is a sinus. So our nasal cavity, the nose passage, they have four groups of sinuses on either side. So they're basically sinuses are big air pockets which have a small mouth which drains into the nose. They are lined by the same kind of skin of the mucous of the nose. The sinus ka काम is to help the humidification of the air, exchange gases, secrete mucus, and also it helps us feel little light in our head per se, what we normally feel. If a sinus is not there, you will not feel heavy. But if a sinus has a problem, then you will start feeling a particular condition. So to have a sinus is normal. It's a normal part of the anatomy. I hope that clarifies. Sinus का problem होना is what very often people refer as मुझे sinus है. Like how people say मुझे thyroid है. Thyroid is a normal gland.
True.
Sinus is a normal part of the anatomy, and there are four groups on either side. I hope that clears that air.
Okay, sir. So when we talk about the disease condition and sinusitis and sinus blockage in particular, so can you just tell what are the common conditions which causes these sinus inflammation or sinus infections in adults and as well as in children? And what are the clinical symptoms which patient comes and refer to you for, and the problems associated with these kind of infections? So what are the types of
Correct.
basic sinusitis? Yeah.
Right. So you've already narrowed down to a particular type of problem that is sinusitis. But broadly speaking, sinuses in any anatomical part would have infective problems. You could have problems of even tumors in sinuses, and you could have other issues also to do. But let's focus right now on sinusitis because, as you said, that is the commonest thing that people come across. So sinus infections, I would typically put as an interplay of three factors. One would be the patient's individual anatomy, and that varies from person to person. The second and a very, very strong would be the environmental factors, which also would vary from person to person, place to place. And the third would be the intrinsic, you can say the immune response of the host, or even the allergic response. So some people have allergic tendencies. So things like allergy or a poor immunity or certain other parts of immunity, as in what are intrinsic factors of a person, that would also play a role. So again, to summarize three things, it would be the host or the person's innate status. Secondly, the anatomical factors, so the functionality, the anatomic factors, and the environmental factors which are responsible. And the interplay between these three is what would predispose or give a higher chance of sinusitis in certain group of individuals.
Okay. Thank you so much for bringing in light to the three factors. And when we talk about environmental factors, here are we talking about the infections and the allergies which can give rise to this whole spectrum of problems and sinusitis. So when we talk about
Correct.
common cold, flu, COVID-19 in particularly nowadays. So how do you rate? Do you see patients with COVID-19 coming up to you with the respiratory infections and also the blockages in the sinuses nowadays in your practice?
Yes. So COVID-19 has been a very different uh, eye opener, I'd say, because it has thrown across a gamut of conditions. Before we go ahead to that, let me just take one step back. Maybe you asked me and I wasn't clear. Uh, when you say sinusitis, you basically are talking of infection of a sinus. Now, what
Yes,
happens is
yes.
anytime anybody has even a common cold, because the lining is the same of the nose and the sinuses, usually there will be some inflammation of the sinuses. This is what we will call maybe acute sinusitis. What do you mean by saying sinus pug gaya hai? Or chronic sinusitis is when the mouth of the sinus gets blocked. And when the mouth of the
Okay,
sinus gets blocked, then it starts retaining the secretions inside, despite even good treatment, which we'll come to maybe later. And that becomes a focus of recurrent infections. So, as
okay,
you
okay.
maybe mentioned a minute earlier about common cold is called a common cold because it's common to have 3 to 4 episodes once. I mean, in the entire year, it's a common cold, right? But anything beyond that would make it a sinus issue. Maybe it has to be looked into. Now, touching upon COVID-19, uh, again, I'm not a COVID as a specialist. I'm not a physician. I'm an ENT and head neck surgeon, and we have seen our infections of COVID also. So the first wave,
Okay.
not too many ENT manifestations, loss of smell was one of it, but essentially a lot of thrombotic events were found in the first wave. The second wave is where it really troubled ENT and the population, with especially what became known as the black fungus or mucormycosis. Now at Sion
Yes, yes.
Hospital, we have been seeing these infections for a very long time. In fact, we've researched a lot about this, and we have certain scale or a criteria of how to even go about with treatment. But yes, during that second wave, mucormycosis became rampant across the country, and everybody started seeing a lot of it. That's a completely different kind of a sinus infection because that is not what we normally call
Okay,
sinus. It had a particular
okay.
pathology to play, a kind of fungus, and a way it was progressing. So if you want, we'll touch upon that later. But if we keep it to sinusitis right now, now what's happening is as COVID has had a third wave and maybe the fourth, fifth, the ebbing waves, we are seeing a lot of symptoms which overlap with even a flu or an acute sinusitis. That means people
Yes.
coming with a cough, cold, fever, yeah, and then a swab coming positive for COVID.
Mm-hmm.
To the extent that more or less now the treatment
Okay,
is going to be
okay,
based
okay.
symptomatically, and I've had my fair share of patients who came to me for a severe cold, got treated, but because they had fever and at maybe a elderly person at home, so they got a COVID swab done just for safety, and then informed me that doctor, we met you, but we are COVID positive, but now we are fine with the treatment you gave. So when you start treating a sinusitis or the symptomatic treatment, it does work for that too. Not to downplay the role of COVID, and people must be careful about it. The other thing, what we have started seeing very recently after the third wave from January, is a lot of people have developed sinusitis after COVID. What I mean by that is that they
Okay,
had
okay.
no recurrent symptoms beforehand. But ever since they got COVID, it became a cold that was not going away. A cold that lingered on for
Okay.
15 days, 1 month, 2 month. And when I asked them in practice that did you have a recurrent history from 1 or 2 years, they said no, doc, we were perfectly fine. It's just that after COVID we got better, but the cold never went away. And
Okay,
again, what
okay,
we mean
okay.
by a
It
cold is
helps.
a varied amount of symptomatology. We'll cover the symptoms maybe in a few minutes of what could be. And those patients on investigation then started showing chronic sinusitis changes. And some of them required, a surgical intervention to manage that too. So
So
currently, I
here
think
we now
sinusitis is, yeah,
yes, sir. So here we now see, as you rightly mentioned, that COVID-19 is like now, presenting itself in the form of chronic sinusitis once the initial infection has been resolved. So this chronic sinusitis problem persists in the patients, and the symptomatological treatment is what is being followed to treat this sinusitis. So, sir, if moving forward, can we just go into a brief about the management part of these particular conditions, and how a patient on his or her own take precautionary measures to prevent sinusitis first, and once it has happened, then a brief about the home remedies also, and the clinical management part. Your take.
Correct. So, yes, we'll touch upon the clinical management and precautions someone can take. Before that, just a quick line about what symptoms can be released. So, symptoms of the cold, typically people think अगर छींक नहीं है और पानी नहीं बह रहा है, these sneezing bouts and watering of the nose are typically allergic symptoms. They are not symptoms of sinusitis per se. When you talk of sinusitis, the symptomatology you may come across is a blocked nose, one side or both sides, a stuffy nose, a thick drip at the back of the nose, what we call a postnasal discharge, or mucus coming at the back, which may be very often yellowish green. There could be heaviness, there could be frank headache, or sometimes is heaviness. Not that feeling of being unwell without having a frank headache at times. And yes, if it is an acute sinusitis, headache and fever would be there. So these are the symptoms that people would come across, and they would look at, okay, maybe I have a sinus issue. Especially the postnasal drip and the blockage is what has to be kept in mind, because every time you may not have a runny nose. Coming to the management bit, I would tell everyone that yes, maybe people overdid steam inhalation in COVID a lot, but a routine steam inhalation once or twice a day for about 5 to 10 minutes, maybe with some decongestant like maybe a vapor or something, or a decongestant capsule, is a very good home remedy. I always tell my patients that don't self prescribe antibiotics, but I would allow you to start taking steam before you need to seek any medical help. Definitely take steam at home. If the throat is sore, do some warm salt water gargles, because these two ghar ke nuske are quite useful. And in up to 40-50% of the people, it doesn't progress further then, unless it's really badly infected, because your host immunity also will take care of it, as long as you're also nourishing yourself well, having a good amount of protein and fresh fruits and vegetables in your diet. So yes, steam inhalation and warm saline gargles are good home remedies. If you are a slightly more alert or astute person, you could possibly take an over-the-counter cold medication, like what we call an antihistamine, and maybe a decongestant, maybe with paracetamol. But that is where I would put a hold on home treatment, because a lot of people start misusing antibiotics, which would not be a good idea. It makes the doctor's job then that much more difficult. Typically, Dr. Pinky, what I tell my
Thank you.
patients is that if you've come to me earlier ever, and if I've given you something and I've told you this is a cold medication, try the cold medication, try steam for 48 hours. If you're getting better, well and good. If not, then please come for a consult. That is the way I keep it.
Thank you so much, sir. And sir, recently, we have seen also that patients have started using decongestants. So sometimes doctors prescribe decongestants, and sometimes patients take it over the counter. Sir, but there is a time limit for how many days it should be used, because over excessive use of it certainly is harmful. So would you like to prevent and tell to our viewers that the protocol for using decongestants?
Absolutely, that's a very good point which you've pointed out, Dr. Pinky. So you see a lot of advertisements, showing that नाक में spray करो 10-15 सेकंड में नाक खुल के चला जाएगा. Look, they're eventually they are medicines, they are medications,
Hmm.
so they have a particular role.
Hmm.
Decongestants are not rescue medicines, and yes, even we as doctors prescribe it and use it, but we use it sometimes even when the patient doesn't feel a nose block, because you're seeing signs of congestion. And that is why they are to be they are to be used under medical supervision in a particular way. Now if you use a one off time, all right, if you had a real severe challenge, no medical help, okay. But I would not suggest to use it on a regular basis. As you rightly asked, what is the challenge? Beyond 10 to 14 days of continuous use of decongestants, someone may actually end up with what is a condition known as rhinitis medicamentosa, or in simple words, it is a rebound congestion, where the medicine itself becomes the source of the problem. The decongestant itself gives a side effect of a rebound congestion, and which is not advertised, which is not told to people, and you don't read the fine print. And that, in fact, the treatment is to stop the
True.
decongestants. So yes, that's a very good point that you got
True.
about,
And this is
and
very
I would
important for
encourage.
you also.
Yes,
And so
don't push
sometimes we
decongestive
usually see,
OTC.
I mean, from the patient's perspective, yes. And so we see patients sometimes they feel that I just have the sinus blockage and it will resolve on its own in 3 to 5 days. I wanted to ask you a question. People usually prefer to go to the general practitioners. When ideally should a patient go to an ENT surgeon? What are those particular signs which a patient recognizes in himself that this is the right time I should visit? Otherwise, my condition will go beyond control to get the proper
Right,
inspection.
that's again, yes, that's a very good question. So when you look at home treatment, and yes, the next station would probably be a family practitioner or general physician. Even for a common cold, beyond 2 days, if it's not getting better, I would suggest to seek a medical help. And yes, that could be a general practitioner or a family physician. Now, typically, when we call a common cold or a cold which is lasting 5 to 7 days, it will resolve with symptomatic treatment or maybe even a short course of antibiotics. A cold which has lasted for beyond, I would say, 10 to 14 days, or if symptoms are recurrent, that means every 1 or 2 months you have a similar symptom recurring where the use of antibiotics comes into the picture, that is a patient who should definitely seek a specialist opinion or an ENT consultation before or after an imaging, because a lot of people use an X-ray PNS. An X-ray PNS in today's era across the country, even in rural areas, is quite obsolete. It will only pick up very bad disease. It is not a good idea to pick up a fair amount of disease with that. CT scans could be done, but I think the timing of the CT scan is very critical, and very often we find not to speak ill about anyone, but at a level of a family practitioner, CT scan may be done at a time when there's an acute cold, which may not be the best time to do a CT. It picks up more disease. As we basically just speak about treatment for a bit, the treatment of sinusitis would be medical till a certain extent, where a role of surgery would come in. So the role of doing a CT scan or imaging should be decided by the ENT surgeon that when the imaging should be done. And that is where I would feel that any patient beyond, to sum it up, 10 to 14 days of a cold which is prolonging, or a frequent cold that is coming every 1 to 2 months only, should definitely have a ENT consult at some point of time. Sinusitis is one issue. There could also be other thing like a mass in the nose which may not be picked up. So we must remember those other diseases
So
also.
thank you so much for bringing to light this duration aspect of it. That if it is persistent and if it is not resolving on its own, then one should visit the patient. So we have an interesting question from one of our viewers, and he says, "Sir, मुझे साइनस की वजह से ईयर रिंगिंग होने लगी है. So please कोई मेडिसिन सजेस्ट करिए." So, is it possible, doctor, that something which we call tinnitus or ear ringing, it is because of the sinus, and how to proceed ahead with its management?
Correct. So thanks for the question. Medicine prescribed karna would not be a part of the forum, but let me explain what is happening. So ENT is connected the ear, nose, and throat because the system is one and the same. There are three different organs. So as you said, yes, the symptom is called tinnitus, and that is because the nose and the ear are connected with what we call a decongestation tube. That tube is useful for regulating the middle ear pressure or beach ke kaan ka pressure. So when someone has a cold, the pressure regulation mechanism is a little lost and the ear pressure becomes negative. Now what happens is, because the ear pressures become negative, kaan ka parda thoda andar खींच jata hai or it gets retracted, and because it has got retracted, it gives a sound कि कान में शायद थोड़ा सीटी बज रहा है, or sometimes they have a feeling of a bubbling sound or a popping sound. So different kind of sounds could be heard. The root cause is to treat the cold. The ear will get better as the cold gets better. If someone is looking for a solution, as we already discussed, the घर के नुस्खे, the steam could be tried out. Decongestants or medication for 1 or 2 days could be tried out if you're getting better. If beyond 48 hours it doesn't get better, it is always good to take a medical opinion, general practitioner or a specialist. Definitely before the ear starts hurting, because then the ear could start getting infected, what we know as a otitis media, because of a cold, because of a sinusitis. I hope that answers the question.
Thank you so much, sir. Hope the viewer gets the point right, and he gets to know the exact cause of his problem. And we have another question. I mean, it's not a question, but it is like what we discussed. That he says that he's suffering with sinus and throat problems after COVID. So, as you rightly mentioned in the beginning of the session, that people have persistent and lingering sinus inflammations long after the COVID has been resolved.
Yes.
So, this is one of the
Yes.
comments we have received. The next comment we have is,
Yes.
"Sir,
So
I'm having COVID." Yeah.
yes. So this is exactly what I
So
was
I'm
talking
having.
about. That we are seeing a lot of yes, we are seeing a lot of such patients who after COVID, that drip at the back of the nose doesn't stop. The post-nasal drip is continuing and that's stopping at throat. And that's the patient who has come complaining about a throat illness. But again, I would even in such cases look to focus on the nose and throat together. The throat has to be treated symptomatically, but the mool karan or the base may be the nose and the sinuses which have got infected post-COVID, and that has to be ruled out with an appropriate imaging, like a CT scan possibly.
Okay. Thank you so much for the information you provided till now. So now let us go to the very layman for our viewers. What are the precautions which they can take? Sometimes, like smoking also, and touching does it
And
count
I
to
apologize for my
increased
network. It's not the
sinus
best right
infections
now.
in?
Could you repeat after smoking? What did you say? Dr. Pinky, I've got your question up to smoking.
Yes. So,
All
sir,
right.
my point
So let me
was:
share my. Yeah.
is there any
Yes, please.
can cause recurrent infection?
I'm not sure if it's my network or yours because I'm not able to see you anymore. So if you were speaking about smoking and recurrent infections, yes, I mean, as a doctor, I would always say, even as a cancer specialist, that do not smoke. And yes, smoking also affects sinuses because it affects the ciliary movement, the movement of the clearance from the sinuses, and that is why the mucus separated nose is stagnant. Apart from this, smoking itself leads to what we know as a smoker's cough, which is irritation of the throat directly because of the harmful smoke, and of course the chance of causing cancers there. Uh, I'm not sure if it's my connection or your connection that is lost. So I think there's been a lack of connection on one of the ends, and if you can hear me, I would just continue to share a couple of tips till then. Yeah, I think Dr. Pinky is back now.
So we are back again, sir. Yeah.
Dr. Pinky, I think the question is on cold water will work on sinuses. Dr. Pinky, can you hear me?
Yes, sir. Now I can hear you, sir.
Yeah, I can hear you well too now. So I think there's a question on cold water and sinusitis, is what I've
Yes.
got a feedback. So yeah, it's an interesting question, and that's something you asked. And one of the experiences that I have. Sorry, that was my network, I think. Yeah, as I was saying, having cold water or sitting in an air conditioned environment increases as the cold is spread around. So there's some reasons that we have had so that is why
So we are facing some network issue, and this brings an end to our very informative session. And I hope the viewers are benefited from this. Please stay tuned to our channel for our next informative sessions every day on the Health Darbar Show. Thank you so much.